This is Business AM. Welcome to Metropole Television. This is our economic review at this point. Get involved 2146 as your SMS line at Metropole TVKE across all your social media platforms. All right, this morning we are asking just one question. Where is the problem as regards the COVID-19 pandemic situation in the country? I just want to introduce our panel this morning that really touches across all the industries and sectors of the economy this morning. And I would just not do that because it's a heavy panel. I'll be introducing them as and when I usher them to come in and then share their sentiments on exactly what is going on in the country. But let's just begin with this story that we have here this morning. Now, President Uhuru Kenyatta has convened an extraordinary summit next Wednesday to review the resurgence in COVID-19 infections. Now, the meeting, which will bring together the national and county governments, has been called in light of the rising number of fatalities arising from the virus, which has seen Kenya record its highest number of COVID-19 monthly fatalities this month. In a statement, State House spokesperson Kanzedena Mabraro has said the session, which is the sixth such meeting since the onset of the COVID-19 pandemic in Kenya, shall consider the evolution of the disease as well as the epidemiological models on how the virus may spread within the country over the months of November and December 2020. Now, she further says the meeting will also review the efficacy of the containment measures currently in place as well as the impact of the easing of the restrictions that were in place before the gradual reopening of Kenya's economy. Now, in a statement, the State House spokesperson says President Uhuru Kenyatta has called on all Kenyans to continue applying individual and collective measures that include wearing of face masks, observing hand hygiene, as well as physical and social distancing, terming these measures as the nation's best weapon against COVID-19. Now, in so doing, the president says, and I quote, and this is where the talking point is this morning. So the quote is this: "Our nation shall not be compelled to roll back the easing of the restrictions that Kenyans enjoy today." And quote, you do not want to enjoy now. Now, the announcement came on a day when 1,018 people tested positive for COVID-19 from a sample size of 6,649, with a record 16 patients also succumbing to the disease, bringing the total number of fatalities to 950. Let's therefore quickly jump to where our infection rates are in the country as we talk about what the president is saying, that we shall not be compelled to go back on those restrictions. All right, let's look at the total confirmed cases January to September. Good. If you look at that data that we have for you this morning in terms of those cases, you'll actually start to see that as from June, July, up to August, up to September, where we are right now, that's when we have that big jump. But I want you to pay attention to where we are as from August and September. Now, that's when you see the graph jumping up sharply. So let's do the same thing for the number of deaths also now from January to September. That's when we go back and look at the number of deaths we've had in October as well. Good. If you look at that as well, it's pretty much the same graph, which corresponds to that easing of restrictions in the country, because as you see, as from July to where we are right now, that's when the graph starts to jump. But now, this morning, we are talking about October, which has been the worst so far. So let's look at the total confirmed cases day by day of infections in October, which is also going to point out to that graph that we're talking about. There is a sharp rise as well. Same thing to the number of deaths in October as well. Same graph. You're going to see that since we started this easing out of restrictions in the country, then you will start to talk about an increase in number of deaths. So same across the board. This morning, therefore, to lay bare where we are right now, let me first start with Dr. Victor Ngani, Medical Director, RFH Healthcare. Dr. Ngani, what does this say? And I know what you told me last time, that maybe we didn't get out of the first wave of infections. But from this graph that we're seeing this morning, maybe, Dr. Ngani, maybe now you'll be back to change your sentiment that indeed Kenya was out of it. Because now it's only that we're talking about higher positivity rates, which we've never seen in the economy.
Well, thank you very much and good morning.
Good morning.
Well, no chance I'm changing my mind. I am more convinced now that we never came out of the first wave. However, what is clear is you also have a surge. So there are two things, and those two things are different. It's a situation where even if we had the first, a flatter curve in the initial part of our COVID-19 fight, it is very, very clear that now we're experiencing a surge, as has been seen in many other countries. And there are clear factors for this surge. However, I'm also categorical. There is no way I've reviewed this data. There is no way that we got COVID-19 under control 2 months ago, and we're seeing where we are. Most importantly, it's very likely, and it's actually a very sad situation, that the testing around that time was not the way it was supposed to be. The numbers were fluctuating, and the sources of samples were different. I don't know if it was deliberate or accidental or just coincidental, because what it did, it created a false sense of security amongst the population that COVID-19 was coming under control. And what did that do? It resulted in one extensive reopening, which is at some degree, that some areas we had to reopen. It resulted in people taking fewer precautions. Everyone is walking out without a mask. And in many, many areas, we are back to the pre-COVID days. And what then happens? We see a surge. I would say that if you look at the trend of COVID-19 across the world, there is no place where, very few places, like Taiwan, hasn't had a single infection for 200 days. But their processes are very specific, their lockdown measures are very specific, and it's very, very different in this country.
Pretty much. Dr. Ngani, I'm going to come back to you therefore as well. This morning, we do have a heavy panel, and I want to run across therefore this morning so that we get a clear idea of exactly what is going on. Let me go back to the studio where I'm joined now by Daniela Owogo this morning. I mean, yes, my question to you is going to be, who is to blame? Because that should be what we're standing for.
Well, good morning. It's been long.
It's been long, right? It's been long.
I'm here. It's good to talk to you this morning. I think, like you've intimated, we really need to find where then did we start, easing out our measures.
Yes.
And who is taking charge, in terms of, making sure that, again, we are rolling back the measures that we had.
Yes.
Well, this is directly attributed to the carelessness of the leadership that we've seen. And before, I think the president was unequivocal when he said very well that even as we ease in this restriction, let us remember that it takes an individual responsibility to make sure that we try to to flatten the curve.
Yes.
And therefore it bequeaths the political class, as you lead towards your gatherings, make sure that you take the leading front in terms of educating the citizens,
yes,
that we are still not out of the hook yet. And so therefore I would answer you directly that our problem, especially with this COVID-19 and the upsurge that we are seeing, is directly attributed to the bad manners of the politicians.
Yes.
Elijah, you could actually see that, even as we speak about trying to contain, trying to have the containment measures.
Yes.
The leaders and the political leadership is already announcing the campaigns.
Yes.
Over the weekend. We are seeing heavy campaigns in central Kenya. We are seeing already campaigns that have been done without even a single iota of taking measures, to avoid the citizens.
Yes.
It doesn't take a rocket science for you to understand that COVID-19, it's easily spread where people do not wear face masks,
yes,
where people do not, wash their hands with clean and soap and running water, and where, we do not keep the safe and social distance. That is not a rocket science. It's simple. But in our gatherings, you have seen that taking place. So I think we do not have to struggle to ask who is to blame.
Yes.
While our medics have been in the forefront, and some of them we've lost, who have gone ahead, with their selfless, service to make sure that they serve citizens.
Yes.
Ours as a political leadership has been backsliding all this kind of, and coming back. We are talking about BBI. We are talking about campaigns. We are talking about, all these political heavyweight things happening in the face of observing COVID-19, in the face of fatalities, in the face of rising numbers.
Pretty
So then
much.
how do we ask, what is this kind if it's not responsible leadership?
All right, Daniel, I'm going to come back to you therefore, because there's a quote that the president did actually say, which is pretty much our talking point this morning, that our nation shall not be compelled to rolling back the easing of the restrictions that we have already relaxed and enjoying today. Just to get a clear picture, therefore, of where we are with the pandemic this morning, I want to introduce this morning Jacqueline Manu, is a medical doctor and public health specialist. Jacqueline, there's this sentiment from one of your panelists this morning, and I'm going to tell you what is said before you join the meeting this morning. Dr. Victor Ngani, medical director, RFH Healthcare, he tends to believe that, well, why are we talking about the second wave of infection when in the first case, we did not even get out of the first one? Do you share the same sentiment, Jacqueline, this morning?
Good morning.
Good morning.
I actually do share the same sentiment.
Yes.
Because in the first instance, the number of people we were testing, according to the first wave,
Yes.
quote unquote, was not even enough. We are not even, I don't even know what fraction of the country we've tested. That is like among 500,000 people, we are roughly almost 50 million.
Yes.
You cannot say you're out of the first wave when you don't even have a fraction of the country. So we, in my opinion, I don't think we're out of the first wave. I still think we've not even seen what a first wave is.
Yes.
Because other countries, you've seen what is happening in other countries, in developed world especially. Most people have acquired the virus, people have died, and they are doing so in huge numbers.
Yes.
So it's coming. Unfortunately, it's coming.
Pretty much. At this point, I'm going to get back to you, Dr. Jacqueline, on that as well, because then there are a lot of talking points in terms of understanding what our positivity rates mean and what we are with the infection rates in the country. Let me just bring in Dr. Peter Muturi. Good morning, sir. Do you share the same sentiment that, yes, we did not get out of the COVID-19 pandemic first wave of infection in the country?
Good morning.
Good morning.
No, I do think there was a first wave because that is what the government thought, because you could see the decline in the testing numbers, and but the number of tests done according to what Jacqueline said, we only tested 10% of the national population, only 10%. You cannot say you got out of the first wave, but it is the government, and at times you do have to follow what they say, but we never got out of the first wave. And the government itself, it reopened before even clearing out.
Yes.
You know? Yeah, no, we never got out of the first wave. Now this is wave 1.5, if I could say it, okay.
Pretty much. I'm just going to leave it there for this morning. And just before we continue with this conversation this morning, because yes, you do expect for us to go back and forth on exactly who is to blame this morning. Now, I want to introduce a man who's in what has been called the hotspot of infection and indiscipline in the country this morning. Mr. Simon Kimtai, Chairman of Matatu Owners Association of Kenya. Mr. Kimtai, would you say that yes, your industry is first to blame for this, what has been a resurgence in infections in the country?
Thank you very much. I think I would want to correct you. There's no time public transport has been seen as a hotspot. And we ain't agents of spread. That's what you should get correctly.
Yes.
One is that when professionals talk, we listen. At the same time, we listen to the government. When the government decides that it's going to open up, they've opened up for political, activities to go on. They've opened up churches. They've opened up social centers like bars for people to go and drink, and other areas. So we were actually asking why are we being discriminated against?
Yes.
They've opened up SGR. They've opened up rail, the DMUs. So actually our concern was they are discriminating. Now, when the professionals talk, which government does not give them a lot of, time to address these issues, when they decide to talk, and yet they are not professionals. when they give us figures and give direction on business doing, some of us who are discriminated against will make noise. And I believe that we have observed the protocols all the time. And another issue is that, as an earlier person talked there, was that all of us have got to take a personal responsibility in ensuring that we don't either spread or don't get COVID-19.
Yes.
So those are the areas we need to dwell in. Professionals are supposed to tell us, because there are issues. Which is the most effective way? Is it social distancing, putting on masks the way they're supposed to be, and sanitization? Professionals should be able to give us guide on the same.
Pretty much.
Yes.
Mr. Kimtai, I'm going to come back to you, and I'm going to throw, you've been called an angry man this morning, and I'm going to play your clip this morning so that now our panel will look at you and then say, Mr. Kimtai, were you getting angry when in reality you should be in the forefront in managing the COVID-19 pandemic in the country? But now, let me just go back to our doctor panel this morning. And Mr. Victor Ngani, I'm going to come back to you this morning, just before I throw in Mr. Orogo as well to weigh in on exactly what is going to happen. Let's listen in to our health CS Mutahi Kagwe on his latest pronouncement of exactly what is going on in the country, and then you could judge from where you sit in this morning whether that in any way is going to help stop the spread of the COVID-19 pandemic in the country. Let's listen in.
A month after President Uhuru Kenyatta de-escalated COVID-19 containment measures in September, the country has walked right into a second wave of the pandemic. From a positivity rate of about 4%, the country is now up to a 15% positivity rate, also recording 54 fatalities just this week.
And I'm sad to report that today, once again, we have lost another 14 patients. This brings our cumulative fatality to 964 persons. In addition, there are some 1,084 patients admitted in our health facilities. At the same time, 35 patients are in the intensive care unit, out of whom 14 are on supplementary oxygen and 18 on ventilatory support. We also have 40 patients who are separately just on supplementary oxygen and not in the ICU. And another 24 patients are in the high dependency unit.
Despite the continued surge in new cases, the government says the health system is not yet overwhelmed.
We are not overwhelmed, especially the counties, because so if you look at the number of cases that Waziri has articulated today, we are way below that number. But in the private sector, especially the private hospitals, because of their limited capacity and the high demand, then you find that the bed occupancy in the private sector is much higher.
And as Kenyans continue to ignore the set measures against the pandemic, the government has now warned that home-based care will take up a bigger chunk of positive cases to allow hospitals accommodate critically sick patients.
There is a limit to how much and how many beds we can keep on creating in the country. Let me make this clear, that individuals who do not have the symptoms of are not symptomatic should no longer be necessarily locked in hospitals. Families, with the support of community health workers, must begin to learn how to manage positive people who are not sick.
Although the government has maintained that there is no cause for alarm regarding COVID-19 in schools, Kagwe has urged Kenyans to adhere to set guidelines as well as exercise personal responsibility.
And if you must go to have a caspation, go outside. Try and do it.
Pretty much. Now, that is exactly what the state is. And Dr. Ngani, I'm going to just read for you these numbers this morning. 964 persons already dead in the country. Now, let's talk about the admissions hospitals. 1,064 patients already admitted, 18 on ventilatory support, 40 on supplementary oxygen. But the only thing that we're getting from Kagwe is that, well, we are fine. We should not be worried. Should we be worried from that perspective? What do these numbers tell you this morning?
Well, 100%, we all ought to be extremely worried.
Yes.
I think within the doctor circles, we have small groups, this, where doctors are sharing the situation.
Yes.
And every hospital you talk to, the situation is worrisome. There are very many people who need support. Plus, remember, even in this situation, we are significantly under testing. I think we've tested less than 2% of the population, and there's a big chunk of people who have COVID-19 and it's not reported. I want to talk a bit about the testing issue, so it's understood. There's an advisor to the US president now, Dr. Atlas, who's been advising that you reduce testing to just those who are symptomatic. When you do this, then you see a decline in your numbers. And it's very true. A country like Tanzania has got COVID under control if we go by the testing policy. And just adjusting how you test and who you test can significantly reduce your numbers or push them up.
Yes.
It does not reflect fully what's going on.
Yes.
And I think that what happened in Kenya was most unfortunate because, number one, we reduced the number of tests we are doing all the way to 1,000. Then the source of tests, we were taking more tests from far-flung counties that had very low numbers. Now, what this did, it gave the impression that we were getting this under control, and this wasn't true. So I keep repeating, I hope it was accidental, not intentional, because the first wave never left us. We never actually got to the peak of it, and this is the time that you're seeing this happening. And I'm saying you should be worried because the real hospitals that take care of healthcare of patients are expressing being full. People don't have beds. The ventilators that are needed are not there. It's not just enough to have a ventilator, but to have critical care capacity.
Yes.
And so there's reason for us to be a little worried. I would understand if the CS doesn't want to spread panic, but then we have to begin to actively look at some of the spaces we've opened, such as bars. Transport is important, but think about the bars. Is it a necessity right now that we must go out and drink and become less inhibited to the point where we can't use our masks?
Yes, pretty much. Let me just bring in also Mr. Peter Kitui Muturi. He's a medical laboratory officer in the country. Now, let's talk about that as well, Peter. I mean, look at the numbers: 964, 1064, 18 ventilator support, 40 on supplementary oxygen, on an infectious level, because we're also talking about the number of people that we're testing. Should we be worried? And what would you have rather had from Mutahi Kagwe?
Yes, I'm going to go with Dr. Victor here.
Yes.
We are supposed to be very worried.
Yes.
Very, very worried. Because now, what happened? There was a big backlog of tests.
Yes.
Not done.
Yes.
Okay? Now, because of the reagents and the requisitions. Now, when the reagents were found, there was this big number of tests done. You can see they were doing 4,000 in a day, 5,000 in a day. Then they started declining as they were clearing the backlog. Now they were not taking more samples. You get it?
Yes.
Now, right now, they loosen their guard. Okay? Now, as we go on, now this is now the guard that was being loosened. It's now the leash is going off.
Yes.
You get it? Yes. No, we are at a very bad point.
Pretty much. All right, let me just bring in, therefore, Dr. Jacqueline Mwanu as well. There's that stress from Tahi Kagwe that, well, community healthcare professionals should now come in and help salvage the situation, especially we're talking about home-based care, which is also quite a big or much of a stress now from him as a public health expert. Dr. Jacqueline, is that possible, going by what the healthcare system in the country is?
Well, it is possible.
Yes.
Because, fine, maybe we don't have, maybe our capacity is small, but I think we should also trust ourselves in doing this.
Yes.
We have very many public health practitioners. We have very many community healthcare workers,
Yes.
right?
Yes.
So all these people can be used to spread the information in regards to how to manage COVID-19. Right?
Yes.
But I was looking at it from the point where if we do this from the root level, at the family level, at the community level, because at the national level, the government has put its measures, drawn its measures to us and said, do 1, 2, 3, 4, 5. But it's just common behavior. If something is not reinforced, if something does not keep on being mentioned, if something does not keep on being spoken about, people will not change what they do, or they will change for a particular period of time and then choose to fall back because of certain reasons, be
Yes.
it economic, financial, or whatever.
Yes.
So the community workers are they are very key people, because they know people at the ground level. So if they have the information, people know what are the most effective ways,
Yes.
and how they can be done. What about holding barazas? People listen to these people. For example, why do people listen to politicians? Why do 100,000 people pop up for political rallies and listen to person X, Y, and Z? Why can't the same people like MCAs from the community, people like MPs, chiefs in communities, they hold barazas, they call people and tell people, today we want to talk to you about what COVID-19 is, because there are still some people who have no idea what COVID-19 is.
Yes.
There are people who still do not believe it exists. There are people who still think that it's not even infectious. There's nothing like that. We are being lied to. So these people are quite important, especially starting from home level, inside home-based, so as to be able to know how can this home-based care be provided? How can community-based care be provided?
Pretty much. Let me just leave you as well on that side as well. Once we come back though, remember, we do have Mr. Kimtai in the studio as well, and Daniel Obogo, who are now going to tell us, so what? And the bigger question for Daniel Obogo this morning is that, is it a culture? Do we have to politicize COVID-19? And why haven't we seen the Ministry of Health given more powers to come in and rain down on these politicians or having public rallies instead of blaming the major part of the economy? As we end the conversation, our doctor panel this morning is going to tell us, so when are we going to start saying, well, we are out of this pandemic? What should we see? Once we come back shortly after this break.